Hello nurses, I am going to discuss some questions that every nurse should know. Side effects of oxygen therapy are all except A. Absorption atelectasis, B. Decreased vital capacity, C. Increased pulmonary compliance, D. Endothelial damage. Answer is C. Increased pulmonary compliance, which means how easily lung expand. Oxygen toxicity makes the lungs stiff, so they expand less easily. Therefore, compliance decreases, not increases. So now we are going to see why other options are wrong. Absorption atelectasis, which is the partial or complete collapse of tiny air sacs, which is called alveoli, in our lungs. Usually, clean air is a mixture of several gases, while it is mostly made up of nitrogen and oxygen. It also contains small traces of carbon dioxide and several other elements. Major components: nitrogen, which helps to keep alveoli open. Oxygen, everyone knows that. So when a patient breathes 100% of oxygen, which replaces nitrogen, which is absorbed quickly into the blood. Once the oxygen is absorbed, the alveoli lose their gases and close, which lead to alveolar collapse, which is called absorption atelectasis. Decreased vital capacity. Vital capacity means maximum amount of air expelled after a maximum inspiration. It decreases when the lungs become stiff and cannot expand fully. Endothelial damage. High O2 for prolonged period, which lead to alveolar damage, which is called endothelial damage. The adequacy of tissue oxygenation is most accurately measured by A. Hematocrit values, B. Atrial blood gases, C. Hemoglobin levels, D. Pulmonary function tests. Answer is ABG, because tissue receive oxygen only after oxygen is carried by atrial blood. Now we are going to see why other options are wrong. A. Hematocrit values, which means percentage of red blood cells in blood. So normally adult male normal value, so 42 to 52 percentage. Adult female 37 to 47 percentage. Option C, hemoglobin levels, so which means oxygen carrying capacity. Normal adult males have 13.5 to 17.5 gram per dl. Normal adult females have 12 to 16 gram per dl. So next, pulmonary function test, which measures lung function, how well air moves in and out. How much is the inspiratory pressure at which CPAP is set? Option A, 10 to 50 cm of H2O. Option B, 4 to 8 cm of H2O. Option C, 8 to 10 cm of H2O. Option D, 1 to 4 cm of H2O. Here is the right answer is 4 to 8 cm of H2O. Why? Because CPAP is usually started at a low to moderate pressure, that is enough to keep the alveoli open without causing complications. Then now, why other options are wrong? So option A, 10 to 50 cm of H2O. Too high as an initial CPAP setting may cause barotrauma, gastric distension and discomfort. Okay, because that we can't choose that. Then option C, 8 to 10 cm H2O, which can be used in some patients with more severe hypoxemia, but not the usual starting pressure. So therefore we can't use that. We can't choose that option. So next, option D, 1 to 4 cm of H2O. If the pressure is too low, which will lead to alveolar collapse. So therefore we can't choose that option. So correct option is 4 to 8 centimeter of H2O. The percentage of oxygen participating in gas exchange is termed as A. SpO2, B. FiO2, C. PaO2, D. PaCO2. Correct answer is B. FiO2. FiO2 means fraction of inspired oxygen, which measures percentage of oxygen in the air that a person breathes in. So now we are going to see why other options are wrong. Option A, SpO2, which measures the percentage of hemoglobin saturated with oxygen. Option C, PaO2, which measures the partial pressure of oxygen in arterial blood from an ABG, which measures how much oxygen has entered the blood, not the inhaled oxygen concentration. So therefore we can't choose that option. Option D, PaCO2, which measures the partial pressure of carbon dioxide in arterial blood. So here's the correct answer is FiO2. You are preparing to transport a patient and the doctor wants the patient to be on the highest FiO2 possible. What are you going to bring? Option A, the nebulizer mask. Option B, non-rebreathing mask. Option C, blender system. Option D, non-rebreathing circuit. Answer is non-rebreathing mask, which is the highest FiO2 oxygen delivery device commonly used for a spontaneous breathing patient during transport. It is simple, portable, and ideal for transporting hypoxemic patients. So, why other options are wrong? Option A, nebulization mask, which is used to deliver medications. Option C, blender system, which deliver a precise FiO2. Option D, non-rebreathing circuit, which is not the standard oxygen device for a conscious and spontaneous breathing patients during transport, unless the patient is being manually ventilated. So therefore, option D is wrong. Which mode of oxygen administration provides assistance during inspiration and prevents airway closure during expiration? Option A, BiPAP. Option B, simple face mask. Option C, CPAP. Option D, tracheostomy collar. Here's the correct answer is option A, BiPAP, because BiPAP which have two airway. One is inspiratory, another one is expiratory positive airway pressure. Inspiratory positive airway pressure, which helps you take a bigger breath and reduce the work of breathing. And expiratory positive airway pressure, which is lower pressure during exhalation, which keep the airways and alveoli open, improving oxygenation, which mainly help to remove CO2. Option B, simple face mask, which only deliver oxygen, which does not provide positive pressure or assist breathing. CPAP, which means continue positive airway pressure, one constant pressure during both inspiration and expiration. The patient take breaths on their own, mainly improve oxygenation by keeping the alveoli open. Here you must know that CPAP mainly treats low O2. BiPAP mainly treats high CO2, especially COPD exacerbation. Next, a tracheostomy collar, which deliver humidified oxygen through tracheostomy. Which among the following refers to the extra air that can be inhaled beyond the normal tidal volume? Option A, residual volume. Option B, functional residual capacity. Option C, expiratory reserve volume. Option D, inspiratory reserve volume. Here is the correct answer is option D, inspiratory reserve volume. So now, what is the meaning of tidal volume? Which means the amount of air that goes in and come out of your lung with one normal breath. So this is called tidal volume. So here the question is extra air that can be inhaled beyond the normal tidal volume. So therefore option D is correct answer. So now what is the meaning of inspiratory reserve volume? So extra air you can breathe in after a normal inspiration. So which is directly linked this question. So correct answer is option D. So now we are going to see why other options are wrong. Option A, residual volume. The amount of air that remains in lung after a maximum forced exhalation. So this is wrong answer. So it is not suitable for this question. So therefore we can eliminate this option. Option B, functional residual capacity. Air left in the lungs after a normal exhalation. So which is wrong. Option C, expiratory reserve volume. Extra air you can breathe out after a normal exhalation. So which is totally wrong. So therefore we can eliminate this option. So the correct answer is option D. When should humidification be used with oxygen therapy? A. When high flows of oxygen are required for longer than a week. B. When high flows of oxygen are required for longer than 4 hours. C. When high flows of oxygen are required for longer than 24 hours. D. When high flows of oxygen are required for longer than 1 hour. Here's the correct answer is option B. When high flows of oxygen are required for longer than 4 hours. Because high flows of oxygen is cold and dry. After more than 4 hours, it can begin to dry the nostril and respiratory mucosa. Humidification helps to prevent dryness of nose and throat and reduce irritation and throat. So therefore, the more than 4 hours we can use humidification. When oxygen therapy via nasal cannula is ordered for a patient, the first action by the nurse is to A. Explain the rules of fire safety and oxygen use. B. Post an oxygen in use sign on the door. C. Adjust the oxygen level before applying the cannula. D. Lubricate the nerves with water-soluble jelly. The correct answer is explain the rules of fire safety and oxygen use. Before initiating oxygen therapy, the nurse should educate the patient and family about oxygen safety because oxygen itself does not burn, but it makes anything that catches fire burn faster than more intensity. So now, why other options are wrong? Post an oxygen in use, sign on the door. This is an important safety measure, but it is done after oxygen therapy is started or while it is in use. So therefore, we can't choose this option. Option C, adjust the oxygen level before applying the cannula. Technically, when applying the device, the flow should be set before placing the cannula. However, this question asks for the first nursing action after oxygen therapy is started. The patient education and safety come before implementation. So therefore, option A is correct answer. Option D, lubricate the nares with water-soluble jelly. This is only necessary if the patient's nasal passages become dry or irritated. It is not routinely the first step. So therefore, option A we can choose. Which among the following is not an indication for oxygen administration? Option A, COPD. Option B, shock. Option C, anemia. Option D, breathlessness. Answer is option C, anemia. Because oxygen is present but there is not enough hemoglobin to carry it. So therefore, option C is correct answer. So other options which need oxygen therapy.